The DEA is proposing regulatory changes that would establish a new system for how doctors prescribe controlled substances like ADHD medications via telehealth. The proposed changes would require anyone who prescribes a controlled substance, including people who prescribe ADHD medications, to obtain a special registration from the federal government and to be in the same state as their patients. Prescribers would also need to make sure that, on average, less than 50% of their total prescriptions for Schedule II drugs are provided via telehealth. These Schedule II drugs are, and this is from the DEA's website, ones that have clinical value but also a high potential for abuse, like ADHD stimulants and opioids. So why is the DEA proposing these changes? The agency says the goal is to keep some of the flexibility offered by the COVID-era exemptions while providing safeguards to help keep people, safe, and to prevent drugs that are prescribed legally from finding their way into more illicit markets. The agency lists a number of reasons, including ones specific to ADHD. They say that the relaxed telehealth rules during COVID, and I quote here, facilitated the emergence of concerning business models. What they mean when they say this are companies like Dunn. The Dunn founder and clinical president, quote, allegedly obtained subscribers by targeting drug seekers and spending tens of millions of dollars on deceptive advertisements on social media. They also allegedly intentionally structured the Dunn platform to facilitate access to Adderall and other stimulants. So telehealth, not all good, not all bad. As a person with ADHD, I've used telehealth to get my medication before. The hoops you have to jump through to get the medication that you need, especially during the shortage, are incredibly difficult for people with ADHD, and telehealth took some of that pressure off. Is it a perfect system? No. But for a lot of us, it's been really useful. And I'm not the only one who's concerned. A lot of families and providers are concerned that conversations like these could lead to changes that make it more difficult to access medication, or exacerbate the stimulant medication shortage that people with ADHD have been facing for years. This is especially serious for people who live in rural areas or places where access to healthcare is limited. According to the CDC, 1 in 5 Americans lives in a rural area, and telehealth can help reduce health disparities by increasing access to timely, high-quality healthcare.